Hello and welcome to Salar. I'm Dardana Simran, and today we're in conversation with Dr. Masood Khan. He'll be talking about the black fungus, how it's spreading, why is it so serious and the most talked about topic right now, and the precautionary measures for it. Thank you, Dr. Masood, for joining in and answering our questions on what the most talked topic about right now, which is the black fungus, is about. So I'd like to start off by asking you, what exactly is the black fungus? Could you shed some light on that?
Yes, thank you, Durdana, and good afternoon, everyone. Uh, I would like to talk to you all about the most talked about and most scary topic today in news as far as health is concerned. That is black fungus. Now, everyone's kind of worried and asking the question because this is not something which we've heard of before. What is black fungus? It is a fungal infection, like how there's bacteria, there's a viral infection, there's a bacterial infection. Like that, we all have fungal infections. At various point of time, we've seen fungal infections, which is not uncommon. Sometimes you get, especially in the hair, you get in skin fungal infections, which is very common. But what we are seeing right now is a fungal infection in the sinuses, and this is happening, which is new. How is it caused? It's caused by a fungus called Mucor or Rhizopus. These are the two common viruses which we see in the environment. Generally, they are there everywhere. Fungus has a particular way of spreading. They have small spores, which are more like seeds. They are like pollen that you see in trees. That's exactly how they are, and they're there in the environment everywhere. You see in moist places. This is more where we see in vegetation, moist places. And we all breathe this in day in and day out.
Right.
And but for certain group of people, it becomes dangerous and it becomes an opportunistic infection.
Right. And that was where I was getting at next by asking you, is the black fungus contagious? And if so, for who? Like, is it just for the COVID-19 patients who have tested positive, or anyone and everyone can, be, can easily get it?
Okay, good question. Mucormycosis, that's the medical term for black fungus. This has been there from quite a while, but it has been so rare that it is not even a reportable disease. If you see a case, we are not, as doctors, we are not mandated to report to a state authority. So that tells us how few the cases we see. Okay. For example, it is seen by an ophthalmologist and an ENT physician. They may see one case in 3 months or 6 months, and now they are seeing, say, 10 to 15 cases a day. This is not contagious. It is not from one person. If I have mucormycosis, I'm not going to transmit it to someone else, unlike COVID.
Right.
It is not contagious.
Okay. And again, so who are at the risk of getting this fungus?
Historically, this fungus is an opportunistic infection. In the sense, what exactly is opportunistic infection? We all have bacteria, viruses, and funguses which are there in our body. Right. But they don't cause any harm because timely our immune system fights it and destroys it.
Yeah.
But there are certain pockets of people like poorly controlled diabetics and people who have had organ transplants, especially solid organ transplant, like kidney transplant, liver transplant, heart transplant, lung transplant, and who are required to be on medication that reduces our immunity so that the organ is not rejected. They are at high risk. Cancer, certain leukemia patients are at high risk who have the immunity suppressed. Right. And such people with AIDS infection were at high risk. So those were the section of people who we used to see this infection in. Yeah. Now what we are seeing is this infection in another subset of population, which this is not a subset anymore. It's become a large chunk of the population who have had COVID, who have had treatment for COVID,
Right.
And especially diabetics who have had COVID and have been treated with steroids.
Mm-hmm.
They are, you have to recognize that this is something which comes in people who are very poorly controlled in diabetics, who have not been taking their medications properly, whose blood sugars have been really high, and who they, and also people who are already immunocompromised.
Mm-hmm.
To them, in COVID, what we do to control the hyperimmune response, we put them on steroids, and
Right.
steroid reduces the immunity and increases the sugar level in our blood.
Okay.
And this combination is bad. And in such a combination, the opportunistic infections,
Yeah.
like especially mucor,
Mm-hmm.
this it becomes a perfect substrate or perfect environment for them to grow.
Okay.
And they are the ones who develop mucormycosis or black fungus.
Right. So, doctor, if I'm getting it right, this fungal infection has always been there, right? But why is there
Infection has not been there. The fungus is around.
Right. So
but not the infection.
Okay, so the fungus has always been there with the diabetic patients. Like you said, if it's poorly managed, then you can sort of get it. But why is there suddenly a surge in the number of cases? And why are we talking about this more than ever right now?
The surge in the cases is because diabetics, first of all, are at a high risk of developing severe COVID.
Right.
So when they develop severe COVID, to treat them, we give them steroids.
Okay.
That steroids causes their sugars to go up.
Right.
Now, like how if we have to do a culture, we need a medium for the bacteria to grow, right? Or a fungus to grow, or a virus to grow.
Yeah.
We need to put them in a nutrient-rich environment.
Okay.
For this fungus to grow, they require a warm and moist environment. And in our body, the warm and moist environment where it's perfect 37 degrees or 38 degrees environment is in our sinuses. They are air-filled, closed spaces. Right. And such closed spaces are perfect. And in diabetics, what happens? Generally, our body is in a neutral pH. Neutral, it's not acidic nor alkaline. Right. But when the sugars become very high, and the patients go into what we call ketoacidosis, okay, the environment is, the secretions are rich in glucose, one thing, then they become acidic. Ketones produce ketoacidosis, and that environment is perfect for the fungus to grow. Okay. And that's how the fungus starts growing initially in our sinuses and a nasal cavity.
Right. Okay. So I think this sort of explains it all. And so I want to move on to why is this, super dangerous right now?
Yes, it is super dangerous. One, because it is a very aggressive fungus. Mm-hmm. When it grows, it destroys everything in its path. Okay. It destroys the bones, it destroys the lining of the cavities, and aggressively grows up and down both. So if we take the center of our face as where it is lodged, it can go up into the eye sockets and the brain, and can go down into the palate and the lungs. And sometimes now we are seeing cases which it has gone into the intestines, stomach and intestines too. Okay.
So you already mentioned that this isn't something that's contagious, but how exactly can we protect ourselves from the black fungus?
Okay. See, to tell you a little bit more about why this is as dangerous. This is dangerous. See, if we catch this early and treat this early, it is like any other infection. But the reason why it is dangerous is, one is the aggression I talked about. The second is we have very limited medication. This medication is not made, or we never anticipated the cases to be so high. So there's significant shortage of medication. Now, coming to your question of how can we prevent this? Yes. See, one of the most important subset of population who we are seeing this disease in is poorly controlled diabetics. Right. Or regular diabetics who, when they take steroids, the sugars go up. Mm-hmm. Now, what I strongly urge everyone who's listening to this is please, 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 in this day and age, control your sugars well. Take your medication, diabetic medication. If you're diabetic and you've been prescribed medication, stick on to that. Follow a very, very strict, controlled diabetic diet. If your sugars are under good control, your immunity is good. If your sugars are bad, your immunity goes down. You not only at risk of COVID and at risk of infections like black fungus. And secondly, if you're diabetic and you're not under treatment, please see your doctor or the diabetologist and get on to medication to control your sugars. Third, if you've got COVID and you're diabetic, please do not self-medicate with steroids, or even if you go to your local doctor may be able to control your fever, but may not be able to take good control of your sugar. Right. Seek the help of doctors who see patients in hospitals and who know how to treat your sugars well. Right. That is the key. So, and get your sugars under control when you're on steroids. If you're able to do that, you're mitigating your risk, you're reducing your risk of developing black fungus significantly.
Okay. I mean, this is something that I genuinely want to know because I'm curious about it. Where did the name of like black fungus actually derive from? Is there something?
If you look at the culture of the fungus, it is black in color. Okay. That's exactly the reason why it is. And what it does, that's one reason. The second reason is this question was very apt. I'll tell you how this fungus grows through vasculature. That means the blood vessels, and it has a nature of destroying the blood vessels. So first thing what it does is it cuts out blood supply to the part which it is invading. So that becomes gangrenous. So people who have this infection, if you see pictures which are very grotesque, very hard to look at, they develop gangrene of the nose, gangrene of the eye, gangrene of the face, and gangrene of the palate. Now, so that's the reason the word black fungus came.
Okay, got it. So I want to culminate this by asking you, none of us anticipated that this would actually, right now, I think it's being termed as an epidemic, right? Especially in the state of Karnataka as well, because if I'm not wrong, then at least like there are a daily cases of 25 to 30 people that are being reported, or actually more than that right now. So coming back to that, there was no initial like treatment for this, because I mean, you said there was some to it, but then it grew so much that you don't know how to handle this. What does the future look like with this, and how exactly can this be treated?
Okay. First of all, I would like to say that people who've had COVID and who are recovering from COVID, please watch out, keep your sugars under control. Now, there are certain signs and symptoms which you need to watch out for and seek care right away. Most important thing, if you have any sinus pain, pain in your sinuses here, if you have any tooth pain, if you have any blackening of your upper roof of your mouth, that is the palate. Right. If you are having any bloody secretions, if the mucus in your nose is blood thin, if you have severe stuffy nose, if you have redness over that eye and swelling, if you have redness of the eye, severe headaches, and if you have double vision, these are certain signs which you should never ignore. Okay. It may be something minor, but earlier treatment is better. A day or two, it can move from mild pain to a point that we may not be able to save your eye, because this destroys the floor of the eye, goes into the orbit and pushes the eye out. That's how rapidly, in 2 to 3 days, that's how rapidly it grows. So, but if you are precautious, if you catch the signs and symptoms early and seek appropriate care, your treatment can be started there. Now, you said what is the future looks like? Yeah. The future Well, there is good. One good thing is awareness. There is always one very important thing is people are able to get information much faster. So there's quite a bit of awareness. That's a very good thing, and I hope they seek care early. And the government is doing quite a bit to not only increase the production of liposomal amphotericin, which is the medication which we need,
Right.
and there are also plans to import in large quantities this medication. This medications, for example, if I tell you, first of all, it is expensive. Second, this medication is an IV medication that needs to be given for not for 3 days and 4 days like remdesivir or 5 days.
Right.
This may require up to 2 to 3 weeks
Okay.
to be given, and till the recovery.
Okay.
It is a long drawn out, so they'll require a lot of medication. So those are certain things which are the intricacies of this disease. Which plus to clear that fungus, they need a surgical option also. They need to open up the sinuses, remove all the fungus which is there. Probably sometimes if it is infiltrated into the orbit, may require your eye to be removed. All this is there are certain things which are different in treatment of COVID versus this. So the future is, there is recognition, there is understanding that it is going to epidemic proportions, and care is being taken. So do not need to panic.
Okay. And this is just for patients with diabetes, or people without diabetes should also be careful of this?
Everyone, have been cases reported without diabetes too, because primarily diabetes, but there are other patients too, because steroids which are given, if they're not given in the right dose. Remember one very, very important, all the studies of steroids that have been done have been low dose dexamethasone studies, or low or equivalent other steroids. Now what very highly enthusiastic doctors are doing is they are using a large bolus doses of steroids to treat COVID, which is not so. So that's why if COVID is treated timely, which is a very precise treatment time, we will be able to use lesser doses of steroids and get them better. So coming to your point that steroids again are the cornerstone, and this are given to non-diabetics also, so that reduces immunity. So yes, people without diabetes also have been seen to get this infection. Other patients like who've been on other immunosuppressant medications like renal transplant patients, cancer patients who have got COVID, and many other patients, who have low immunity.
Got it. Okay, so I think this pretty much sums up what exactly the black fungus is, what we need to do, the precautionary measures, and if there's any parting comment that you have to make to just raise awareness to the public, you can do that, and we can wind this up.
Yeah. To sum up, black fungus is a serious disease which we need to be aware of. This is not something which we cannot control. We have to watch our health. Health is the most important aspect. Manage our sugars, eat well, have a balanced nutrition, recognize the symptoms of COVID early, and get proper treatment early. Don't hesitate to get treatment. You get treatment early. We don't need to put you on large doses of steroids, and that will protect you against even these unforeseen complications like black fungus. And also, if you are on unfortunate and you need to be on steroids, watch out for the signs and symptoms that I just mentioned, which is sinus pain, eye pain, redness of the skin and swelling of the skin around those areas, toothache, pain in the roof of the mouth, all these aspects, stuffy nose and blood tinged mucus coming out from your nose. These are certain aspects. If you see any of these, seek care immediately without any delay. Early treatment will be life-saving.
Okay, so you heard it. It's early treatment for you to save yourself, and that is something that I think we should all keep in mind with this. But having said that, thank you, Dr. Masood, for taking out your time again and sharing this information. I hope that it reaches a larger audience and it helps people. Thank you.
Thank you, sir.